Good afternoon, everyone. My name is TaWanna French, and I am a social worker with the Denver Department of Human Services. My title is a business operations administrator, but all in all, basically what I do is train and recruit foster parents. I am coming to you today as I am going to be presenting information to you all about the intersection of moral injury, employee turnover, and permanency outcomes. Actually, throw in there moral distress as well. So the intersection of moral injury / moral distress, employee turnover, and permanency outcomes. I have been working for the Denver Department of Human Services for the past 18 going on 19 years. I've held various positions during my stay here at Denver County. Prior to that, I also have been a therapist in the community, not only here in Colorado, but also in North Carolina after doing my master's level work. So have experience providing that direct care to families and children. And I also am an adjunct professor at the University of Denver in the Graduate School of Social Work. And I've been doing that work since 2019. So quite a bit of years of experience in child welfare and just social worker overall, about 25 years. So that's just a little bit about myself. In addition to my professional life, I also am a mom of 2 children. I have an 18-year-old daughter and a 10-year-old son. And so I am super duper busy. But my passion when it comes to my professional life is really making improvements in the work that we do and changing outcomes for families. So that is what we are going to dive in today when we talk about, as I talk about the research that I've been doing over the past several years. So as you see is the why behind this work. Why is this so important? It's important, again, because as social workers, everything that we do, whether it's on a very high macro level, a meso level, or a micro level, everything that we do is tied to a living, breathing human being. And so there's implications for the work that we do. And so it's so important to make sure that we are always examining ourselves and making sure that the work that we are doing is impactful and actually helping and not causing more harm. So that's why we are looking at this work. As I said, I've been in this field of work for several years, 18 going on 19 years in child protection, and just really seeing the impact of moral injury / moral distress that it has on the workforce, and really looking at other things when it comes to providers of color and all the other things that we battle in the workplace when it comes to institutional racism and things like that that are impacting the work that we do, that then impacts staff turnover and permanency rates for children and youth in care. So as I was doing research and really started looking at this, I was doing my research and looking at some other items when I came across this particular article. It was from the Children's Bureau in 1960. High rates of turnover in child welfare has plagued us for many, many years. So this statement from a study published by the Children's Bureau in 1960 says this: turnover of staff in social agencies has been a serious concern of agency administrators for at least the past 10 years. Repeatedly, at conferences and in the professional journals, the complaint has been heard that staff turnover, number one, handicaps the agency in its efforts to provide effective social services for clients. Number two, is costly and unproductively time-consuming. And number three, is responsible for the weary cycle of recruitment, employment orientation, production, resignation that has been far from helpful to the reputation of social work as a profession or to the community's respect for the agency as a stable social institution. That was a direct quote from William B. Tollan, who was the Assistant Director of Research of the Children's Bureau in 1960. In addition, that report included an unprecedented examination of turnover in child welfare, and they were able to determine that the average overall turnover rate for caseworkers and public child welfare at that time was at 36%. And the rate for resignations alone was 24%. So high turnover rates impact many variables when it comes to child welfare. It impacts the children and the families we serve, and it affects agencies overall. And it hits us in a number of different ways. And so really understanding this is driving some of the work that I am looking at. Prior to the COVID-19 pandemic, national turnover rates in child welfare hovered between 20 and 40%, and even higher turnover rates for trainees. This number has now climbed and is anywhere between 36% and 60% across the United States. The pandemic has worsened pre-existing issues within the workforce and increased rates of compassion fatigue or secondary trauma, burnout, and moral distress. The Child Welfare League of America Nature Public Health Emergency is a collection conducted a study to measure post-traumatic stress disorder, grief, burnout, and secondary trauma experienced by social workers in the U.S. during the COVID-19 pandemic. And the results showed that 26.2% of social workers met the diagnostic criteria for post-traumatic stress disorder, 16.2% reported severe grief symptoms, and 99% reported high compassion fatigue. 63% reported burnout. And so these numbers are pretty profound, which shows that there's a significant amount of work that we need to do in terms of taking care of our workforce and really paying attention to that, because ultimately it impacts outcomes for families. Caseworker turnover has been linked to more time spent and out-of-home care, which is linked to poor placement stability. Staff turnover during critical junctures in a child's placement may result in resource parents losing the support that they need to maintain a child's placement and can negatively impact the children's behavior. So it's very important that we take a look at this and really understand why this is important. So when it comes to my PICO, after researching, this has changed a couple of times over the course of the past 10 months. But ultimately, the question became, to what extent does employee turnover impact permanency and is related to moral injury / moral distress, lack of training, and ineffective supervision? What are important and evidence-based strategies that are needed to improve retention and improve permanency outcomes for youth? So once coming upon this and coming to the decision that this is what I'm looking at, my methodology, as stated, started with a literature review to really understand what moral injury / moral distress is, gain clarity on the impact of worker turnover and permanency outcomes, reason for caseworker resignation, and ways to improve retention of the child welfare workforce. Again, the workforce data include staff engagement surveys, also the intent to stay, and turnover rates, specifically here in Denver County in the past 36 months, really to look at to see if this agency looks different from what's happening nationally and areas that we can improve permanency rates for the children in care. When we look at the child welfare workforce, there's about 10,000, a little over 10,000 workers that work in child welfare in the United States of America. And so there are a number of different factors that impact our workforce when it comes to reasons why they leave. And so education, workforce in government agencies versus private companies, salary ranges. And when it comes to our field overall, when we look at nationwide, the salary ranges are anywhere from 30,000 to 45,000. And those are entry level positions with an average of about 45,000 a year. When it comes to the race of social workers, 63% are white, 15% identify as being Hispanic Latino, about 13.4% identify as African American, 2.6% Asian, 1.5% American Indian / Alaskan Native, and about 4.2% falls under the other range. These are statistics according to ZIPA. When it comes to the child welfare workforce, and this was verified by census data from the Bureau of Labor Statistics. So the impact of caseworker turnover. There are a number of different ways in which caseworker turnover has impacts on the child welfare workforce. When we look at the workforce overall, there's increased cost and time recruiting new workers. There's more time spent onboarding and training new employees, and the added responsibility and increased stress on tenured workers causes another level of stress, as newer employees cannot manage the same level of caseload responsibilities. So when the staff are constantly turning over, those seasoned workers, which is very few, it leads to them being burnt out a lot sooner because they have higher caseloads that is really hard for them to manage. So when we're looking at child welfare tenure stats, of the 10,000 workers that are in child welfare, less than 1%, less than 1 year, 23% of the workforce leaves in less than 1 year. When it comes to the second level, 35% of the workforce leaves within the first 1 to 2 years. When it comes to 3 to 4 years, about 12% leave, 16% leave within 5 to 7 years. Only about 5% leave within that 8 to 10 year range, and about 9% leave 11 years plus. So as you can see, when we're looking at the first 1 to 2 years, that's the highest rate of turnover. About 58% of the workforce leaves within the first 1 to 2 years of service. So it's something that we absolutely have to take a look at and really understand how we can improve so that we're not having such negative impacts on families, and we'll get on that as well. When it comes to impact of caseworker turnover, some things that happen is that cases transfer between workers. When this happens, there's a loss of historical knowledge. It hampers relationship building between the new caseworker and the family, and it complicates duties of all who is involved. It leads to poor outcomes for children and families. Reunification and permanency are less timely, and there's higher rates of children remaining under an agency's jurisdiction. And then the emotional consequences for the children and families due to the lack of continuity and delays causes another level of trauma for children and families who have already experienced trauma being a part of the system itself, coming into care. The children needing to be removed as a result of being exposed to trauma. So a system that is set up to help is unfortunately causing more harm due to what is going on in our workforce. Robin Leake, project director of the National Child Welfare Workforce Institute, otherwise known as NCWWI, says this: Innovative change leaders see this crisis as an opportunity to address long-term problems and to look at their system more holistically. You can't separate broader child welfare issues from workforce issues. We have to change the way we operate, the way we provide services, and the way we structure programs. So again, it's very important to make sure that we are looking at this work. There was another study that was done by PCG Human Services, and what was found when really understanding the impact of child welfare the workforce when it turns over is that when it comes to permanency rates, when a child has one caseworker within 12 months of the case being open, they achieved a 74.5% timely permanency. But when it dropped to two caseworkers in a 12-month period, it dropped from 74% to 17.5% permanency. And when it came to three caseworkers within that first year, that 17% was cut 3 times to 5.2%. And it goes on and on. So the more caseworkers a family experiences, the less likely permanency is achieved within a timely manner. It also leads to children lingering in the system and not achieving permanency overall. So that is the impact of some things that are going on when it comes to the workforce. And so this also causes a significant amount of other problems within the workforce itself and what we're experiencing. And this is when the dynamic theory of moral distress comes in with child welfare workers. Moral distress is coined in the 1980s by Jamington. Is basically saying that moral distress results in painful emotions experienced by someone who is aware of a morally right action but unable to act on due to both internal and external constraints. So when it comes to internal, this is referring to an emotional response in the moment, whether that's fear or not having the confidence. There's a number of different things that it refers to. And then when it comes to external or reactive is lingering feelings of distress afterward. So these studies focused predominantly on nursing and healthcare, and there has not been a significant amount of research that has been done in the child welfare field when it comes to this specific dynamic. However, social workers, just like nurses and doctors, are first line. And so some of this translate, but much more studies need to be done within child welfare to really understand the impact of this. So again, as stated, this occurs when confronted with the conflict of wanting to do the right thing, but facing obstacles to taking that action. Whether referring to initial or reactive moral distress, scholars have asserted that it is conceptually different than other forms of psychological stress or burnout, and that moral distress involves ethical dilemmas and is the result of a perceived violation of one's core values and duties. Further, moral distress implies feelings of complicity and powerlessness to alter the state of affairs. Indications of moral distress include feelings of emotional and psychological imbalance, frustration, anxiety, guilt, sadness, and powerlessness. Research on moral distress among nurses and healthcare professionals indicates that it is also associated with negative outcomes such as patient disengagement, low job satisfaction, turnover, burnout, and leaving the profession. So despite being broadly examined in the helping professions of nursing, there's also no research on moral distress in the child welfare profession, with only a few studies examining this topic in the related field of health care social work. So it is a much needed area that we have to pay attention to. Child welfare and why this is something that we need to focus on. Factors that are different from healthcare is that when it comes to child welfare, the moral distress and moral injury that the workforce is feeling grows over time. And because of that, it contributes to system constraints that prevent child welfare staff from acting in ways consistent with the values of the profession. So knowing the right thing to do, but not being able to do that. And when you know that and it impacts a family's life forever, that's a lot for one person to hold on to. And when you have a workforce that is very new and hasn't had the life experience or time to really understand how to work through this, this in itself is perhaps what could be causing the turnover to happen so quickly. What does this cause? This causes checking out and numbing of feelings within the workforce. And that then itself causes quitting due to the unmanageable workloads, time constraints that are impossible to meet. And it seems like in the beginning that these are the reasons why people are leaving the workforce. High caseloads, low pay. But after examining this and looking at this and really understanding what is going on, there is this, when we're looking at understanding moral distress, some of the things that comes up is what we see here. The growth of moral distress and coping strategies is what we see on the screen here. And so as a result of this, this shows how moral distress is depicted as shock. So we have moral distress right here. When someone is experiencing moral distress, it causes them to check out. They then check out and then abandon their values in the workplace, overall values in life. And then it causes one to then go into an area of self-protecting, then a violation of values that then builds more moral distress. Higher rates of moral distress then leads to quitting. And when one quits and leaves, it then decreases that moral distress. So this is why you're seeing such an exit of people, perhaps from the child welfare field. Again, there's a significant amount of more research that needs to be done to really understand what is happening and what is going on when it comes to this. Some examples of what the workforce has said is, I love being able to assist the families that I work with. However, when I see that they need assistance in areas where perhaps I am unable to support them, it causes me to become somewhat upset because my hands are tied, because I cannot help a family in a way that they really need to be helped, either due to policy or financial reasons. So I know the right thing to do, but I'm unable to do it due to systematic things that prevent me from really being able to help them. So this is examples of ways in which they feel this way. And when engaging this way, staff reported feeling defeated, overwhelmed, depressed, devalued, and sabotaged as a result of this type of work. Some other workers stated this: my education, social work tells me that our job needs to be done in such a way that is effective and that our clients are not revolving door clients. And so when I see generation after generation after generation coming in, or I see that a family is just staying in the system and sitting for long periods of time and not moving forward, it shows that we're not doing what we need to do by this family. And as a result, they just continue to cycle in. So what work are we really doing? How are we really helping when generation after generation continue to cycle in and out of our system? Is the system being more helpful, or are we causing more harm as a result of the work that we're doing? So this is things that the workforce is stating when it comes to the work that we do and the impact that it has. So again, something to definitely look about. Also, when we go a little bit deeper and look at this full model of understanding the consequences of checking out when these things happen, as you see on the screen, there's a number of different things that are going on. So the basic model that we talked about before, but all the external factors that come in that then impact the work that we do. This one up here being pretty profound, being new to the field, not having the experience that I need, not always knowing what to do and having the training to know what to do, or the consistent communication between me and perhaps my supervisor of really knowing what to do. So having this as a factor, then having the inability to help clients in the manner in which they really need help. So this causing a violation of values. Then we're looking at all the other things that goes on. When we look over here, when it comes to workload, so having the time to really be able to give time to the families as needed to do the work that is necessary, that then leads to inability to help, which then leads to a violation of values that they hold. I got into this work because I wanted to help, but there's so many other things that are impacting. High workload that I'm only able to spend a very small time with them and not really understand truly what they need. And I'm just putting a Band-Aid on it. Not only that, when my time is really taken, not only do I have problems with being able to meet the needs of my clients, it then leads into my personal life, and I have the inability to care for my own family, which then is a violation of values as well. And so as you can see, there's a number of different factors that impact caseworkers in the child welfare workforce that is leading to moral distress and burnout. We haven't even talked about the impact of paperwork, policy, bureaucracy, or a culture that prioritizes numbers over people. All of this leads to one quitting because they're at their breaking point and they can't give anymore. So coming into this field of work because there's a need to help, but so many things happening that's going on that's causing problems within the child welfare workforce to really do the work that is needed. So that's a little bit of an introduction about the impact of moral distress and how it causes one to quit as a result of all the external factors that are going on. Other studies that I looked at includes when doing the right thing feels wrong, moral distress among child welfare caseworkers. Again, somewhat very similar to what I talked about in the previous slide. It occurs when a professional knows an ethically appropriate action, but is unable to respond because of internal fear, not having the experience, not having the support, or institutional constraints that prevent them from being able to do this. The moral complexity of the work is seldom acknowledged or researched in child welfare, so much more work needs to go into this. But then what happens is indications of moral distress within the workforce, feelings of emotional, psychological imbalance, frustration, anxiety, guilt, sadness, and powerlessness. So again, this came from really doing some interviews with child welfare workers who have left the field that felt safe enough to really talk about the reasons why they left. So again, on the surface, it appears that people are leaving the workforce because of high caseload and pay. But when we really look at part of the reasons why they are leaving, it's this moral distress, moral injury phenomenon that we need to look deeper at. When doing the right thing feels wrong, again, continued. Moral distress contributes to negative outcomes. So disengagement with clients, low job satisfaction, which leads to burnout, which leads to higher rates of turnover, and just overall staff welfare leaving the profession. So, of course, this was a global look at the impact of this within the child welfare field overall. When it comes to the county that I work for, specifically Denver County, I was able to get numbers when it looks at how our staff in Denver County are the turnover rates. And so this is the last 3 years. And so it was broken down by race, but there doesn't seem to be a difference in who's leaving the field when it comes to race. However, there's much more work that needs to be done to really look at and understand this dynamic. But overall, Denver County appears to be very similar to what is happening within the nation. When it looks at this, 75% of the workforce in Denver County is resigning from their positions within that first 1 to 2 years. So highest rate is resignation. This green represents workers who were terminated during their probationary period. And then we have a percentage of people who retired in the last couple of years, as there was some incentive due to COVID-19 for early retirement. And so that's why we see this particular trend in retirement within Denver County. And so, again, really looking at the work that we're doing, and if there's any indication of the staff turnover in Denver County and the impact that it has to permanency outcomes for children. What I found in the research that I was doing is that, unfortunately, it's really hard to tie these two phenomena together because our systems don't really talk to each other. So it's not connected to really understand the impact of staff turnover and permanency outcomes for children. But what we were able to look at is the impact, or how many caseworkers permanency outcome rates for those who did not achieve permanency within a timely manner and what that looked like. So more research is going to be done on this. In fact, the data team at my county has taken a lot of the research that I am looking at to really start to see if our systems can talk to each other, to really track this, to see what is there, so that we can do much more work internally to preserve our staff so that we have better outcomes for children and families. So as we see on this particular slide, what this slide shows is those who achieve permanency in a timely manner on the left-hand side, and on the right-hand side, in green, and those children that did not achieve permanency in the timely manner. So as you can see, overall, there does seem to be a higher amount of caseworkers that have touched the case for the children who did not achieve permanency outcomes in a timely manner. So definitely something for us to continue to look at when it comes to the work that we are doing here in Denver County to maintain our staff, do some things differently so that we improve our outcomes. This is just another look at it when it comes to the breakdown of race within Denver County, because overall the children that are in care in Denver County are higher rates of children of color, which is not anything unique, because that's the trend across the nation as well, is that children from the BIPOC community make up higher numbers within the child welfare system than the majority. So this just is looking at that same phenomenon when it's a breakdown by race of children achieving permanency outcomes versus not. So another area for us to do further research on to see how this has an impact. So caring for our child welfare workforce is very important. And so when looking at this and really understanding the impact of moral injury and moral distress, one study that I looked at talked about changing the way in which we do our work. And Child welfare professionals have a fundamental right for workplace well-being, opportunities to develop and advance in their career. So this is where the phenomenon of the biopsychosocial framework came in, and really understanding what this means and how to do our work a little bit better in child welfare so that we are maintaining our workforce and doing right by our workforce with this. So the biopsychosocial framework includes physical or biological well-being, psychological well-being, and social well-being. So this all together, this is George Engel's biopsychosocial model, and it's a model that proposed a more holistic view of health and well-being involving an interplay among individuals' physical, psychological, and social environments. So drawing from Engel's biopsychosocial model, our workplace well-being framework includes these dimensions and really looking at making an impact and doing the work that we are doing in child welfare better. So making sure that when we come in, that we're setting up a self-care plan for social workers to really take care of themselves. So when we're looking at physical well-being, general physical health being in the forefront of our mind, workplace safety, as you see in the blue up here, and understanding the impact of secondary trauma. Doing the work that we do brings a level of secondary trauma, and really making sure that we're staying on top of this. Child welfare workers are regularly exposed to unsafe work environments, and also just the trauma that the families go through impact us in a number of different ways. When it comes to psychological well-being, as you see in the green here, making sure that we are focusing on job satisfaction and really doing surveys to make sure that the workforce is satisfied. And if they're not, finding ways to make improvements, creating that sense of psychological safety in the workplace, really understanding that when a decision is being made, that it's being backed, and it's the workers are going through sound training that really does prepare them for the job that they're doing. And really making sure that we're paying attention to burnout and keeping that in the forefront of our minds. So during supervision, making sure that this is something that we're paying attention to, and making sure that there is enough time off for people to break away from work and really heal from the work that we're doing. And then also when it comes to inclusion and equity, really looking at the impact of systemic racism within our systems that impact the workforce overall. So these are things to do to improve, to make sure that we are doing better within our agencies, and making sure that we also are looking at it from a social well-being standpoint. That's where you see in the yellow. So making sure that the workforce has social support. This is one of the most important qualities of relationship, is social support. So creating this within the workforce so that people don't have to look for it outside, that it's already built into the way that we do our work, and creating an effective management of work-life balance, so that, again, people feel that the work that they're doing is not impacting their overall home life as well. So this is just a way for us to look at perhaps ways of doing our work a lot smarter and better for our workforce. The National Child Welfare Workforce Institute, NCWWI, did a report, and in their 2020 report, it really collected agency data to identify the crucial workforce strengths and challenges, to develop a framework that examines many different domains, of which I just talked about in that previous slide, about ways to make sure that we are really taking care of our staff and we are doing everything that we can to make sure that there is an overall well-being, needs are being met, and that the workforce feels supported and taken care of, so that when these decisions are being made, they feel confident in the decisions that are being made, and that they are actually helping families and not causing more harm to the families that we are doing this work for to really bring about change. So this report talks about aims to support better outcomes for families and to sustain a high-performing, resilient workforce. So again, continued work in this area with really examining the impact of moral distress and making sure that we are taking care of the workforce and spending money and dollars into making improvements so that we have better outcomes for families. So this was the work that I did over the past several months. I hit a significant amount of barriers when it came to this. However, overall, really understanding that moral distress is a real thing. Moral injury and moral distress is a real thing that impacts our workforce, to the point that our organization has to understand that our workforce is turning over at a very high rate. And when they turn over, it causes a significant amount of harm to the people and the families that we serve. And children and youth aren't meeting permanency outcomes as a result of that. So knowing that this is real, what are we going to do differently moving forward? So in Denver County, we're going to continue to do more work with really understanding the impact of this and how we can improve the way in which we do our work so that we have better outcomes for families. And again, really looking at it from a holistic point of view and understanding how to have better outcomes for the BIPOC community, who already battle a number of different things when it comes to child welfare. And again, making sure that we are creating systems that are equitable when working with families and children. So overall, this has been an amazing experience. What has been the impact of MPLD to me with doing this work? Number one, it really helped me build leadership skills with really understanding transformational thinking and thinking much higher on a very high macro level. So not just the work being done in my county, but overall across the nation, how can we do social work, particularly child welfare work, better so that we have better outcomes for families? Because again, we're doing this work to help, not to cause more harm. It increased my skills with the use of research and data analysis. I've always been into data analysis and research, but this just fine-tuned it for me. Numbers mean something, and so it's really important to look at the numbers and understand the numbers so that we can do better, so that we can change the way that we do our work and do better by families. It increased my knowledge in ethical decision-making. Again, why am I doing this? For better outcomes for children and families that I feel that we in child welfare are so privileged to serve. So creating better systems for people. Additionally, it increased my desire to educate the child welfare workforce on issues of moral injury and moral distress. A lot of the workforce have no idea. So they all talk about feeling all of this, but didn't have a name, didn't know what to call it. And so really educating our workforce about the things that you are feeling are very real things and putting a name to it: moral injury and moral distress. And so again, furthering the work so that we are bringing about large systemic changes in the way that we practice in child welfare. And then overall, it has provided me with networking opportunities to meet amazing people all across this country, movers and shakers in child welfare, and just partnering with others to really understand how we collectively as a body can do some work to change the way that we do work in child welfare. One thing that I really want to highlight in terms of this, as stated, is the data analysis team in my agency has restructured their focus going into 2024 and are going to be looking at factors impacting outcomes based on this research, and also work on leaking turnover rates of staff with permanency outcomes in Denver County specifically, to see exactly what we need to do to improve the work that we're doing. And who knows, maybe the work that we're doing in Denver County will be recognized and other agencies will look at this to do better work in child welfare for their families. So it has been an amazing pleasure to do this work. I look forward to continuing this work at a much higher level, just to continue to improve outcomes for families and children. Again, this has been an amazing experience, and I've grown so much as a person, professionally, and in a number of different ways as well, with really understanding why this work needs to be done. And even when you hit obstacles and you want to give up, you have to keep going, because again, at the end of the day, everything that we do in child welfare, from the very, very top to the very micro level, is tied to a living, breathing human being. And it's worth it to do this work. Thank you.